Hi guys, and welcome to another video on Dr. Hair Loss's channel. This video is a series of videos in where I review various different hair loss medications, treatments, modalities out there. Today's video is about oral minoxidil. Well, if you or your loved one or anyone you know is taking oral minoxidil or is interested in taking oral minoxidil, watch this video till the end because I will be telling you about side effects, mechanism of action, the science behind oral minoxidil, and who should not think about taking this tablet. So let's start. So hair loss, particularly androgenetic alopecia, male pattern baldness, is a prevalent condition affecting millions worldwide. Now, oral minoxidil, which was initially used as a blood pressure medication, has gained attention as an effective treatment for hair loss. I'm sure you've heard of Regain, Rogaine, and it comes in various different names, is topical minoxidil that the FDA has approved for hair loss for many years. Many of you have used it, some swear by it, some find it not very helpful, and now there is an oral tablet. This is a relatively new kid on the block. In this article, I'll be providing an in-depth review on usage, advantages, side effects, and clinical insights on oral minoxidil as a hair loss treatment. So let's start. So firstly, how does oral minoxidil work? Well, it promotes hair growth by enhancing the blood flow to hair follicles, prolonging your anagen phase of hair cycle, increasing your follicle size. When you take minoxidil orally, it increases your systemic absorption, offering a more consistent drug delivery compared to topical applications. As you can imagine, topical minoxidil can be a pain to use. You need to use it twice a day. Sometimes you've taken a bath in the morning, your hair are wet, you cannot use it. Other instances are when you've forgotten to use it because you're just simply not available at home. Well, oral minoxidil can be an effective adjunct or a replacement. So, what does the science say? Let's talk about clinical studies and efficacy. As I said, it's a relatively new kid on the block. Several studies previously have highlighted the efficacy of oral minoxidil in treating hair loss. A systematic review in 2024 demonstrated that low-dose minoxidil significantly improved hair density in patients with androgenetic alopecia. The study also reported that people who took oral minoxidil had a better outcome in terms of compliance compared to topical minoxidil. And a randomized control trial actually just this year compared the efficacy of oral minoxidil to topical solution, concluding that 1 milligram of oral minoxidil was as effective as topical minoxidil in promoting hair growth with fewer side effects. So, how to take it? There are various different dosages, so which one is right for you? Well, I always advise going with the lowest dose possible. So the dose ranges from 0.25 milligram to 5 milligram per day. Now, studies have suggested that you start at a lower dose, i.e. 0.25 to 1 milligram. I myself take it. I take it at 2.5 milligrams and I started at 1 milligram. Dose adjustment should be based on your response, tolerance, and the higher the dose you can tolerate, the better the outcome. I personally would advise speaking to a medical professional and trichologist to understand what is the right medication dose for you. So, how does it work? How does it stay in the body? Well, half-life of approximately 4 hours, which means that you can take it twice daily. I myself take it once daily. I've just found it helpful. My hair have shown regrowth, and I've also shown a halt in fall, so I'm quite happy using it as 2.5 milligram once a day. You need a consistent concentration over a few days after taking the right dose. So, most importantly, everyone who has hair loss knows that this is a battle for a lifetime. Any treatment that you're on will likely be with you for the rest of your life. So, what are the side effects of oral minoxidil? Well, good news is it's generally very well tolerated. You do have side effects though. Firstly, ladies, you need to listen up. Anyone with polycystic ovarian syndrome should not be taking minoxidil. And the reason for that is you already have a problem of excessive hair growth, which we call as hypertrichosis. There often hair is seen on the face, on the arms, and you don't want them. And minoxidil will certainly increase that. You may have read this article in New York Times where people started taking oral minoxidil but also started having hair regrowth on their face, which is of course not ideal. The other people who cannot take oral minoxidil or should advise against it are people with cardiovascular conditions, people with angina, high blood pressure, or people with other antihypertensive medication. What it can do is drop your blood pressure even further. It can cause dizziness, it may cause fluid retention, and especially if you're waking up at night to go to the toilet very quickly, you can have something called a vasovagal syncope. So I would advise people to be very careful in self-medicating with minoxidil and certainly speak to your medical professional. And finally, with any other medication, there is this risk of rashes and allergic reaction. And again, this is very less common with minoxidil, but there is a theoretical risk. What about women who are pregnant and breastfeeding? Well, actually, safety of oral minoxidil in this condition has not been established. Hence, I would advise against taking this tablet. So, what is the summary? Who should avoid oral minoxidil? Well, as I said, the individuals that have the above mentioned conditions should avoid oral minoxidil. Anyone under the age of 18 or over 65 without medical advice should refrain from using this tablet, and speak to your medical professional whenever you're in doubt. So, in conclusion, I think oral minoxidil is a fantastic and a promising treatment for hair loss. Its compliance and efficacy is much better compared to topical solutions. However, it is very important that you speak to your medical professional because careful patient selection and monitoring are essential to mitigate side effects and optimize your outcomes. I hope you found this video helpful. Click on the link below if you want to look at other videos, and please subscribe to my channel. This is Dr. Hair Loss. I'm a certified trichologist, medical professional, a medical doctor with over 15 years of experience, and I've suffered from hair loss myself for all my life, and I will give you the best advice which is scientifically proven. Thank you.